I'm David Mason, the Director of Public Health, and this is Delta Wave PSA number 3. And as we usually do, we'll provide you updates from the public health nurse, chief, and then basically the thoughts of the COVID team, and we'll go from there. So we'll start with Chief Burke with the update on numbers.
All right, good morning, Dave. As of today, 18 August, we have 18 active cases that we are tracking. We did peel off a bunch today. So currently we're at 1818. Hospitalizations are still far below where they were last winter and early spring. We had the initial bump of the UK variant March, April. So the hospitals are still maintaining. And the Commonwealth as a whole is still hovering around anywhere from 900 to 1,200 cases daily. Pretty consistent for the last couple weeks.
Okay, and then also we've had you've been offering your testing to the community as far as the business community, and we've had people taking advantage of that? Yep,
that's been, it's the BEAT, Business Employment Assistance Testing COVID initiative. We started that in May, and we've had several businesses take advantage of it. And I think one of the examples we've talked about, I'm not sure if I've said it here in one of the PSAs, but there was one company in town and their employees were uninsured and didn't want to pay for a test. But we had the ability to test all of them at the fire station as part of the Beat COVID initiative, and they were all negative. It was all good news, but it dictates what's out there, that testing is still difficult to find, and our priority as a COVID team, when we look at response and recovery and the financial implications, is to keep our businesses operational as much as we can, especially in this prime season. And it's been successful so far. A bunch of businesses have taken advantage of it, and I think if you make it easy for them to do, I think they will take advantage of it. And we had the potential to head off a couple of potential cases that would have spread within the business itself. We were able to head off early. So I'm very pleased, and I appreciate the Chamber of Commerce's support, Denise and the staff there, getting the word out to the businesses, and the businesses being as open and transparent with us and communicating with us to let us know what's going on and to be able to administer tests as needed.
And I think the important thing to point out too is the accessibility. It's easily accessible, as you noted, that there's limited availability for testing. The county is supposed to start up testing again August 22nd over at the Falmouth Fairgrounds. We're not sure of the time frames that they're offering. We're just Chief is offering a greater level of accessibility so that you're not waiting days to get tested either. So it's working out really well. And I think that community is appreciating that.
Yeah, and I think having the 7-day-a-week availability, so you may get a call on Saturday morning and you reach out to me, and we get in touch with that person, and within an hour or two, they are being tested. They're not waiting till Monday. They're not waiting. The sooner we can get them tested and identified and then let them know what's going on, the better. And again, I can't be more appreciative to the Chamber and to everybody for working together on that to keep our businesses moving forward. That's a key component to this.
Yep. So, and then Chief had mentioned also, just for a clarification or to re-explain, I'll use that word, active cases. Active cases means those individual positive cases that are in their quarantine, their isolation time frame. And so as far as each day or a few days, some of those, as we refer to, will be peeled off, meaning that they've met the level of isolation time frame, and now they are off isolation and no longer being monitored at that point. So, at the beginning of the week, actually, I was at a school committee meeting where we talked about 32 active cases as of Monday. As of today, we've peeled off cases, so we'll add, subtract. It's just a running number what is currently active in the community. And in looking at that with the public health nurse, Joanne Gake, each active case has active contacts that we're following also. So you may see now 18 active cases, but there is a web out there of additional individuals that are being quarantined as direct contacts. So, and it depends whether they're vaccinated or not. But for the most part, that is, how the numbers are explained each time. And just one of the things I wanted to bring up as far as the school age is in terms of active cases, when I went to the school committee on Monday evening, the school committee is looking to make a determination whether to require masking or not for the coming school year. Some of the statistics at that time on Monday that were provided, as far as school-age children positive cases account for the majority. Whereas, we have in 50-year-olds 4 cases, 60-year-old 4 cases. The majority of that 32 were school-age children, and that speaks to the fact of the inverse of what we were seeing last year. I mean, you were doing a lot of transportation last year.
Yep.
So of your older population. So that speaks to vaccination occurring, in that older age group, and cases have shifted to that lower age group at this point. As far as that discussion too with the school committee, just for public's awareness, one of the documents they're reviewing, you can review the school committee, but it's the document from the Department of Elementary and Secondary Education, which outlines, the protocols depending upon which direction you go of masking or non-masking, and they're evaluating that document, and how to, it's not an interpretation, it's very specific on their guidelines of what happens if you mask, what happens if you don't mask, and who's contact, and who's a direct contact and who's not, and, is period of isolation, period of quarantine, whether they're in school or not in school. And I believe the school committee is looking to make that determination at their next school meeting, but we just supplied information for their decision-making process at that point. So they're making a logical decision on that, not just whether we like it or not, to base it on what's occurring in the community and in the state, and how the state is asking you to respond to that. So that was a wrap on that. I believe in terms of our positivity rate, it's now down to 2.91 in the county. We've seen a drop on that. The group had spoken about, and you'll see it in other towns, as far as determinations made by other towns as far as masking, not masking. Some towns have masking just in town hall. Some towns have mandatory masking. Established at that level. We had been advising masking based on that 3%. It's just, again, an awareness of the situation and what's occurring in this community to protect yourself. Any other thoughts, Chief?
No, I think it goes back to testing and the tools that are out there. And what we've been able to utilize at the fire department is the ability to test our employees when they come back for their first shift. I think that's important. Whether they're vaccinated or unvaccinated, if they're symptomatic, we're doing testing. We have air purification machines now running in all 3 stations. We have the Thermo Fisher aerosol sense COVID air sampler running in our high priority areas in the station. And I think when you can put all of these things together, you can move forward. And I think that's been our goal, is to move forward as safely as possible, not go back, go forward, utilizing these tools. And again, it has been a busy August. Call volume is up over 50% in August. We're doing 20 to 22 calls in a 24-hour shift. And again, part of it's Delta variant driven, part of it is everybody is here and enjoying themselves, and that's par for the course in the summertime. But as we move forward, and we said this in our last PSA back in May, is that we would keep the testing platform available for municipal employees through January 1st. And we have not wavered from that at all, and we will continue to do that. The focus is to keep government open and operational for the people, and this town has done a fantastic job since May 26th of 2020, having town buildings open and functional for people to do business, and that's this COVID command team's goal, to keep that moving forward with whatever processes come into play. And you're right, things change daily. And where we were a year ago, marching into the school year with levels of testing and what we were going to do, I think we're in a different place this year, and the state has stepped up for schools to provide the potential for large-scale testing, which takes the burden off of the fire department this year from having to do school-based testing, and we can solely concentrate on our critical infrastructure first responder employees.
Very good, yes. And we were talking earlier before we went on here too, as far as, forwarded a chart to Sandwich Television to see if we can get that up. But just what that chart represents as of today is a comparison of caseloads, positive caseloads, looking at last summer and then looking at this summer. And it is, it's different on the fact that we're seeing a spike this summer, whereas last summer we saw like a constant case number for the months of June, July, and August going into the school year. Whereas right now we're seeing a level of a spike, and if that can be put up, it's just helpful to see, and that's part of the tools we utilize in determining the group uses and determining the decisions that we put out to the public, or advisories we put out to the public.
Yep, I agree. And again, you can look at, and we do this all the time, the states that were heavily impacted initially with Delta, where are they at now? We're a couple weeks behind them. Same thing with Europe. Use the information that's in front of you, and I said to you a couple times, August 31st has been circled on my calendar to see where we are with numbers, because that's an 8-week cycle. And these seem to run in 8 to 12-week increments, these spikes and then the declines. And I'm curious to see, I hope we are in the downswing then, but that'll be about 8 weeks from the initial July 1 Provincetown cluster. And to see where the Cape is at with all these people that have been here this summer, what do we look like, heading into school? And again, the key is having a safe and solid school year for the kids. And, and I'm looking forward, as many parents are, probably getting their kids back into school and getting them into that sense of normalcy. And it looks like sports are going to be, fall sports are fall sports in the fall, which is good. So football, soccer, cross country, everything's going to be happening like it should in the appropriate season. So I just hope that, like I said, we can keep the momentum moving forward and get back to as much normalcy as we can within the next year or so.
Very good. Yeah, because as far as the determination also, the masking was removed from outdoor sports at the end of last year. So going into that's expected.
Yep.
Or anticipated, unless there's a different decision made. But again, as you said, it changes by the minute, really, as far as even the state documents that come out will change, within 3 days with revisions as far as what the content is. So it's just this, constant ability to just move and be quick on your feet to what's coming out. It's no different than it was last year. It really was kind of responding to it the same way.
Yep, I agree.
So, anyways, so I think we're put out the information that we have for this week.
We'll be back next week.
Be back next week, and until then, be safe, and we'll talk to you soon.
Thank you.